everybody. It's nice to see you. Our Ministry of Health podcast. At this time, I'm Wana, midwifery student of Aceh Health Polytechnic, as the host. I'm not alone. I'm with.
Hello, my name is Rara, a nursing student of Aceh Health Polytechnic. Both of us will be at the house today. Would like to introduce our special guest from WHO International. She is Dr. Carrie Mikel. Hi, Miss.
Hello,
Yeah, nice to meet you.
Nice to meet you. Enjoy the island, Bali.
Thank you. Yes, very much.
Well, now we are going to do a podcast. Maybe adjust the camera.
Okay, Miss. First question. What do
And in that department, I am the focal point for nursing and midwifery workforces.
Yes.
So in that role, in the headquarters, we do a lot of the development of the global evidence. So we do the State of the World's Nursing Report, which we did the very first one in 2020 to provide the global evidence of the nursing workforce. And we also did the State of the World's Midwifery Report with UNFPA and ICM in 2021. And those were the data and the evidence, and those things help inform the global strategies. So right now, the active global strategy for nursing and midwifery is called the Global Strategic Directions for Nursing and Midwifery from 2021 to 2025. And that was the very first global strategy that was adopted by the World Health Assembly. So that is all the ministers of health from all of the 194 countries all agreed to and endorsed the global strategy for nursing and midwifery. So that was very exciting. It gives a lot of power to the nursing and midwifery leaders on how and where to invest and to strengthen nursing and midwifery in their country, so that it can be contributing and advancing health in the way that we know nursing and midwifery can. So in my position, I develop the global reports, the global strategies, and then work with the regional offices of WHO, like the Southeast Asia Regional Office, to support the countries to advance their country versions of the strategic plans for advancing nursing and midwifery within their wider health workforces.
Okay, and question. For how long do you work there, and what you share in the podcast?
Yes, I've been in that role with WHO for about 6 years. Prior to that, I was working with the U.S. government for the Centers of Disease Control and Prevention. My initial training is a nurse and master's in public health degree, and work with strengthening health systems in developing countries.
Okay, next, do you think are more challenges that nursing and midwifery face?
Well, right now, from my role, we are working on the next State of the World's Nursing Report. It will be released in 2025. So right now, we are very thankfully receiving all of the nursing workforce data from all of the countries. So we are getting right now the picture of nursing in different countries and regionally and globally. So I think from that perspective, I can already see that there's still the big challenge of shortages. There's still the big challenge of very inequitable distribution of how many nurses and midwives there are in the different countries. And the regions are very different in terms of how many nurses and how many midwives are available. And that density of nurses and midwives for the population makes a big difference, because you know how many services nurses and midwives provide, and if you don't have enough of them, the population is not getting the maternal and child health services or the wide scope of services that nurses provide. So that is a big problem in terms of making sure that essential services for the population. So the shortages are a big issue. The inequity is a big issue across between countries. It's very inequitable. Within the countries, it's very inequitable between the urban population and rural populations. We know there's a big challenge and shortages with education. How many nurses and midwives can be graduated? And it's not just the numbers that need to increase, but we know we need more faculty to teach, right? There's a bottleneck, they say, with the number of faculty, the number of clinical sites. I don't know if you have had any challenges in terms of where you have your clinical training. Is there enough equipment, space? There's a lot of other students in those spaces, so making sure that the education has all the elements that we need. We also see big challenges with the working conditions, not enough of the equipment, the infrastructure, but also the pay. We're seeing the ranges of pay very inequitable and not very suitable. And we know that is a big driver of international migration. It's an issue with the shortages, and really an issue of supports and safeguards in the workplace. Is there enough mental health supports? Is it a work environment that has managerial conditions that are conducive and that make nurses and midwives feel supported and not so stressed and not contributing to burnout? So the work environment. And then there's also an issue we've talked about at this conference today about leadership, right? Where we need not just the highest level of nurses and midwives in the government, which is important in the Ministry of Health, leading the policy making, but also represented in the other levels of the government and the hospital, so that not only nurses and midwifery leaders informing the planning for the service delivery of nursing and midwifery services, but also into health policy and in other layers of the management and governance.
My question: what strategies will be carried out by WHO in improving quality of midwifery in nurse?
Well, our role is to really use the evidence to make policy guidance, and that policy guidance is intentionally broad. It's based on evidence, but it's broad enough so that it's really your decision. It's your initiative of each country to understand, based on these policy directions or these policy options, what makes the best sense for your country in terms of where and how to invest. It might be, using your own data, your own evidence about your own country's situation. Where is the best place to invest? Where is the biggest need? And that element is really the country decision. And what we try to do as WHO is to support countries to make sure you have that data. And so we do that, for example, from the State of the World's Nursing Report, State of the World's Midwifery Report, which is country-reported data, and we work with countries to make sure that data reporting system is strong, and that's basically, health information systems. So some of the support that we give is to make sure that you have strong data, and that if you need support, countries need support with analyzing the data in terms of what your health labor market looks like. What are the inflows of nurses, outflows? What's the situation with employment and deployment and unemployed nurses and midwives and service delivery challenges, that we can help look at that data, conduct some analyses, help you figure out where are the points for investment. So that would be something that the country makes based on your own evidence and situation.
So, what are the most prevalent problems in the world regarding nursing and midwifery?
Well, those are some I think I mentioned already in terms of the inequity in where nurses are and where midwives, where they are in the countries, and that very big difference in the density per population. There's a big difference in how countries are able to address the shortages. For example, if the shortages are not enough graduates, and some of the challenges are how do you increase the capacity to graduate more nurses, to graduate more midwives. Other challenges have to do with managing migration, especially of nurses. It's a little less for midwives, but and then really how to improve the working conditions so that it is nurses and midwives are retained, and that other people choosing profession, other young people choose to go into the profession. It has to be something that is attractive. And attractive is maybe has to do with the working conditions, with the pay, with the career progression, with the education level, those kinds of things. So it really takes examining all these different factors to understand what are the biggest challenges and then how do you address those.
Can you give us some motivation for future nursing and midwifery?
Motivation.
Yeah.
Well, I think in general, kind of taking what I've talked about at the global level and the role of WHO in terms of having and generating data, using data for decision making. I think that is something that you can do at a personal level and a clinical level, thinking that as nursing students and midwifery students, you will soon be in a clinical setting, and you will always have the opportunity, I think, to either generate or find evidence, whether it's at a patient level or a facility level, to use that evidence and the data for your decision making, even for broader dialogue and discourse about change. But really, that data, dialogue, and decision making about the actions to take, I think, can be something that is at a personal, clinical level, at a national level, the data, dialogue, and decision making, and even at the global level, we encourage that. So I think that's something that you can do to always make sure you've got the data for your decisions and your actions.
Thank you so much for our discussion. I hope you will be more successful in very job.
Hopefully you can have a good experience like you.
I hope so too. I'm sure you will. This was wonderful. Thank you so much for inviting me.
You're welcome.
Thank you, God.
Thank you.